Hey there, it's Dr. Jim. I have a really good topic today: chronic illness and spirituality. This is one of those things that I've always been interested in because I've always been a fairly spiritual person, somewhat of a religious person. And of course, as a gerontologist, I'm always concerned about illnesses, chronic and otherwise. So many people living with a chronic illness may struggle with everyday tasks, relationships, careers, and even their faith at times. While receiving care or treatment from healthcare providers, they may feel that they are being viewed not as a whole person, but as a condition, a disease, or a diagnosis. Dealing with one's chronic condition and the many stressors it may be associated with can significantly impair a person's ability to cope and to continue coping. Some will turn to spirituality to find strength, peace, and the ability to live their best life with their condition. So, let me define exactly what I mean by spirituality. Many experts find it very difficult to define something that is so intangible, multidimensional, complex, and deeply personal. Some definitions of spirituality can include anything that affects the soul. It refers to a dimension in our lives that provide us meaning or purpose. Spirituality involves a journey or a personal quest for understanding the really big questions in life. You've asked them, I have asked them, why? Why am I here? What am I doing? What comes after this? What am I supposed to be doing with my life? What are the most important things before I die? What does it all mean? These are some really big questions that are very difficult for some people to answer. For others, they know. They know and they don't struggle so much. But when you're diagnosed with a major illness, chronic, long lasting, sometimes debilitating, here's a big question: why me? Why me? So, spirituality is different from religiosity. Religiosity involves really taking part and following a specific religion, taking part in its rituals, and believing in the teachings of its God, its Lord, or its larger power out there. So, chronic illness, on the other hand, I'm not talking about, breaking an ankle or, going through a tough bout of the flu here. I'm talking about long lasting diabetes, heart conditions, recovering from stroke, Huntington's disease, Parkinson's disease, ALS, things that are really multiple sclerosis. These are long lasting, very chronic. So, health conditions technically that last over 90 days and are expected to worsen over time are considered chronic illnesses. They also tend to occur more often in older adults and in seniors. While symptoms of chronic illnesses may be managed through medications and other treatments, ultimately there's no cure for them. We can treat symptoms and help people to live their best life, bring some quality to life, so on and so forth. Okay? So, the most chronic illnesses in the United States are as follows: cancer, heart disease, stroke, diabetes, arthritis, Alzheimer's disease, depression, COPD, chronic obstructive pulmonary disease. Those are the big ones, okay? And they're going to affect a lot of people. They do now and they will in the future. What's the connection? I'm talking about chronic illness and spirituality, okay? It's been known for some time that health and spirituality have many important connections. Chronic illnesses tend to disrupt a person's life in so many ways that can lead to depression, anxiety, loss of hope, meaninglessness, irritability, and a loss in coping skills. But spirituality for many people is equivalent to coping. Spirituality is coping. So, spirituality can be relied upon as a coping strategy for traumatic or negative experiences in a person's life, including being diagnosed and living with a long-lasting chronic illness. It helps to increase one's sense of meaning and purpose, which can lead to greater resistance to stress. In this sense, then, spirituality can be viewed as a buffer to negative experiences associated with chronic illnesses. Spirituality, a buffer, a coping mechanism, decreases stress. Sounds all good to me. Finding meaning in pain. I read a lot. I research every single day. And came across some really interesting information about finding meaning in this pain that people experience. Pain is associated with lots of chronic illnesses, we know that, and can completely disrupt a person's life. Pain can also cause psychological problems, anxiety, depression. Those can, in turn, exacerbate pain symptoms. Pain causes depression. Depression, in turn, causes more pain. Vicious cycle. Many people who are spiritual may find meaning in their pain and their personal struggle. It may help in bringing peace and calm, a reduction in their distress, and hope that the pain will pass, either here, now, or later. Some people see pain as a spiritual encounter. That's a very interesting concept. Some people may experience their condition as a spiritual encounter with something that is way beyond themselves and completely out of their control. They may attempt to allow pain to simply be, to accept it. In some Eastern religious material, I read a lot about getting a grip on pain, embracing it, and then letting it pass. It doesn't have to be housed within us. It doesn't have to linger. This deals with a lot of prayer. This deals with a lot of meditation, obviously, to allow pain to visit me and then pass through me. This encounter is an experience involving physical, emotional, and spiritual qualities, as well as a means of being connected to a higher power or to God. Ultimately, this helps the individual to cope much better with pain and chronic illness. Here are my final thoughts. Although young and middle-aged people live with chronic health conditions, a majority are those 65 years of age and older. Many older adults and seniors will live with long-lasting chronic illnesses that may cause a lot of pain and a lot of suffering. Spirituality can help people through some of the toughest times in their lives as they experience their illness. It can bring hope, better coping, and ultimately improve the quality of their physical life, their emotional life, and to live more holistically. I'm Dr. Jim. Thank you for sticking around for this topic on chronic illness and spirituality. Keep coming back for more. Thank you for your time. I hope you enjoyed the video. And if you'd like to learn more about our products, you can find the link to the website in the description. And I'd also like to give you a coupon code if you'd like to try some of the products. For your first purchase, use the code YouTube to receive 20% off your first purchase. I hope you enjoy the products.